Hello, this is Dr. Dan Hebert of the Duxbury Animal Hospital, and I'm here today to talk to you about leptospirosis, or lepto for short. Leptospirosis is a bacterial infection that's very common in our area, and we vaccinate for it as a core vaccine. But the reason I want to talk about is we still get quite a few puppies coming in from breeders with instructions that say, do not allow your veterinarian to vaccinate for leptospirosis. It is a very dangerous vaccine. Sometimes they'll say it's within that breed or whatever, but I will say that their fears aren't completely unfounded. We did have a vaccine about 30 years ago. It was pulled from the market for causing pretty bad allergic reactions. Turns out it was more of a production problem than anything to do with the vaccine. We've had new vaccines for about 25 years now, and multiple companies make them. They're very safe. It is perfectly okay, but I get where it comes from. I just want to try to educate people as to why it's no longer very good advice. So what leptospirosis is, I said it's a bacteria and it lives in wetness. So it likes wet soil or puddles. But whereas a lot of people think it's like a parasite where they have to ingest the water to get it, it actually gets in through little cuts and scrapes in the feet. So the bacteria has a very high affinity for iron, which is a component of blood. So it'll swim its way in through any little cuts and scrapes in the dog's paws. And then it gets into the liver and kidneys and tries to set up shop. So the problem with leptospirosis is that pretty much every wild animal in our area has it. There's raccoon lepto, deer lepto, squirrels, foxes, rats, mice, that kind of thing. So when it gets in, it tries to infect, but it really is, it knows it's in the wrong species. And the body then will try to clear it out. And the body's dealing with this infection is actually what causes the majority of the problems. As it tries to get it out of the liver and kidneys, it starts to damage the tissue. The dogs usually will survive, but most of them will need some pretty heavy duty care if they're very sick, meaning going for ICU care, many times needing dialysis. So I've seen bills as anywhere between $15,000 and $30,000 and plus that for some of these dogs that were super sick. So they're definitely worthwhile to vaccinate. The history of lepto is actually a little interesting as well. Duxbury and Plymouth exists because of lepto. For those that know the history of the area, we know that people actually tried to colonize before the Pilgrims did and were chased off by the local Native Americans for almost a 20-year span. During that time, though, rats were getting off the boats and they ended up spreading leptospirosis to the local animals, and that eventually got into the people. So, again, for those that know the history, know that when the Pilgrims arrived, 90% of the Native American population was dead. And they called it Indian fever. And more recently, we've been able to look at the DNA from tissue samples from that time, and we've determined that Indian fever was leptospirosis. So, Plymouth area, Duxbury exists because of leptospirosis. So for vaccination, like I said, there are plenty of new vaccines that are out there now. They go after the four most common types of lepto that we see infecting dogs. It's extremely effective. It's anywhere from 92 to 97% effective based on studies. And when we get rid of the vaccine, like it happened 30 years ago, we do start seeing outbreaks. So there was a population of dogs in the Santa Monica area in California very recently that all developed leptospirosis. So they all went to high-end dog parks and private dog parks and high-end boarding facilities. And many of them got very sick. Like I said, $15,000 to $30,000 of treatment later. When we've looked into it, though, basically every single dog that had this was not vaccinated. So they had never had a vaccine for leptospirosis. So again, considering the cost and the risk to your dog, definitely an important vaccine, why we consider it a core vaccine. So if you have any questions about this, feel free to give us a call. Our number here is 781-934-5300. And I thank you for your time.